Hello, I'm going to explain to you why you would take the BMJ formula. BMJ stands for bone, muscles and joints, and it's a complex formula which contains calcium, magnesium, zinc, copper, manganese, vitamin D, vitamin B6 and glucosamine sulfate. And there are a lot of good reasons why all of these ingredients are in one formula. Let's take a look at bone formation first. We need calcium for bone formation, but we don't need a lot of calcium when we have all the other ingredients. Actually, it's not good to take a lot of calcium, especially not by itself, because that may cause calcifications of the arteries and vascular system, and you certainly don't want that. Magnesium is important because that has actually shown to prevent calcification of the arteries. So that's one very good reason. But magnesium by itself also supports bone formation, which a lot of people aren't aware of. There's also a lot of other good reasons for having magnesium in this formula. It's a very, very important mineral. And we supply the magnesium in an amino acid chelate form called magnesium glycinate, which is very well tolerated and very well absorbed. That can't be said for all sources of magnesium. The most common one is magnesium oxide. The only good reason why companies are using it is because it's very cheap. For you, it's no good reason whatsoever, because taken in larger amount, it is a gastrointestinal irritant, and it can give you diarrhea. The other minerals, zinc, copper and manganese, also support bone formation. And when you have all of these minerals together, you don't need a lot of calcium. Vitamin D is in there because that's important to help absorb calcium better, and it has shown to help prevent fracture. Let's take a look at neuromuscular function. We need both calcium and magnesium for that, and especially magnesium is very important because it's not that uncommon to be marginally deficient in magnesium, and one of the most common symptoms of magnesium deficiency is muscle cramps, and it's completely unnecessary. Let's look at joint health and cartilage, which is extremely important since you practice Jiu Jitsu. It's important for everybody actually, but especially for you, because if you practice for a while, you most likely have noticed that you have some aches and pains in your fingers, because these joints are stressed quite a bit when you practice. So the sooner you can start to support cartilage and joint function, the better off you are. We have the original glucosamine sulfate material in the BMJ, because not all glucosamine sulfate are equally effective, and the original formula is the one which has most of the actually good research behind it, so that's why we choose to use that one. Two very well designed studies done by two different research groups showed that taking this type of glucosamine sulfate 1500 milligram per day, milligram per day actually, over 3 years stopped further degeneration of cartilage in patients with osteoarthritis. That's very impressive. You don't really see many things you can take which has research showing that it can stop cartilage degeneration. Actually, there are nothing as far as I know. You can of course take anti-inflammatory medication, but that just inhibits pain temporarily, and it comes with a lot of side effects. Some of the very serious gastrointestinal side effects, gastritis, ulcers, and even cardiovascular side effects if you take it long term. So it's not a good solution. Glucosamine sulfate, on the other hand, has not shown to have any side effects at all. And one of the first studies, they even compare the powerful anti-inflammatory ibuprofen with the glucosamine sulfate. And they found that, as expected in the beginning, the anti-inflammatory ibuprofen inhibited pain more effectively. But after a week or so, the glucosamine sulfate was actually more effective, surprisingly so, but that's what it showed. And it can be taken long term. It just makes your cartilage healthier the longer you take it, but you need to take it regularly. The other minerals, zinc, copper and manganese, is also important for the joints, because we need zinc, copper and manganese to make SOD, the body's own antioxidant enzymes. And patients with osteoarthritis have shown to be have low levels of SOD. So that's a good reason to have them in there for cartilage. We also have, as you know, the vitamin D in there, and patients with osteoarthritis, they have shown to have more severe symptoms when they are low on vitamin D. So all these substances work in synergy, so they actually work really well together in one formula. It makes it easier to take also. You take 4 capsules in the morning and 4 capsules in the evening, and you take it with food. Take it regularly, and after a comparatively short time you should see a nice difference.